Integra Neurosciences is committed to the care and treatment of the neurosurgical patient and to the education of our customers. The purpose of this video is to explain the standard setup, operation, and post-operative maintenance of the SELECTOR Integra ultrasonic surgical aspirator. This video does not address every possible situation involving the use of this aspirator and appropriate accessories. If you have questions about anything contained in this video, the directions for use on which this video is based, or anything not addressed in this video, please call your Integra Neuro specialist. This is the SELECTOR Integra console, which is sitting on the service module. Place the system in a convenient position outside of the sterile field. Locate the service module cord and connect into the power outlet located on the left rear panel of the console. Plug the power cord into the mains inlet, which is located on the upper left corner on the rear of the console. Then plug the power cord into the wall receptacle. When surgery demands the use of 2 receptacle canisters, the following directions are recommended. Step 1. Place the filtered Abbott liner with blue tubing into receptacle to the right. Step 2. Place unfiltered liner with clear or white tubing into receptacle to the left. Make sure that the liners are well sealed to the canisters. Step 3. Connect the vacuum port tubing to the top of the yellow T on the filtered canister located on the right. Step 4. Take the blue tubing from the filtered canister on the right and attach it to the top of the T on the unfiltered canister on the left. Step 5. Take the reusable tubing with yellow end and attach both ends to the bottom of each receptacle T. Step 6. Take the tubing from the unfiltered canister on the left and attach it to the top of the filtered canister on the right. At the end of this setup, you will notice that the top of the unfiltered canister on the left has a patient port open. This is where the tubing from the handpiece will be connected. When surgery demands the use of 1 receptacle canister, the following directions are recommended. Step 1. Place the filtered Abbott liner with blue tubing into receptacle to the right. Make sure that the liner is well sealed to the canister. Step 2. Take the vacuum port tubing and connect to the top of the yellow T. Step 3. Take the blue tubing and connect the end to the bottom of the yellow T. At the end of this setup, you will notice that the top of the canister has a patient port open. This is where the tubing from the handpiece will be connected. On the console, lift irrigation pole and pull to desired height, securing by turning knurled locking ring clockwise. Hang an IV bag of normal saline or lactated ringer solution onto the hook. Turn on the power by flipping the switch, which is located on the left rear panel of the console below the mains inlet. On the front display panel, press the aspiration increase button to the desired setting. Typical aspiration settings are between 70% and 100%. Press the irrigation increase button to the desired setting. Typical irrigation settings are between 2 milliliters per minute and 8 milliliters per minute. Press the power increase button to the desired setting. Typical power settings are between 70% and 100%. Assemble the SELECTOR handpiece in the sterile field using the SELECTOR wrench set. Warning: failure to use the SELECTOR wrench set during the assembly and disassembly may cause damage to the handpiece. If the pieces are not tightened properly, the handpiece could overheat and not function properly. Correct tightening of the joints can be assured only by use of the wrench set. Using the appropriate wrench set, place flat 2 of the handpiece and secure in the appropriate sized slot of the holder. Screw the silver angled extension into the handle by hand, and then tighten it in a clockwise direction with the spanner. Reposition the handle of the handpiece securing flat 1 into the appropriate sized slot of the holder. Screw the tip into the angled extension by hand, and then, using the spanner, tighten the tip by turning the spanner clockwise. Remove the handpiece from the holder and attach the black shroud onto the handpiece, ensuring that the shroud is centered and aligned with the silver angled extension. Warning: failure to center the shroud may lead to overheating of the handpiece due to improper alignment. Attach the clear flue by firmly pushing into the shroud until completely placed in position. Open the selector tubing kit onto the sterile field. The kit contains a sterile tubing kit, hose clips, and a stylet. Remove the tubing kit from the wrapper and turn the tubing kit over onto the table. Locate the double lumen tubing from the center of the sterile tubing kit and connect to the irrigation and aspiration ports on the back of handpiece. If using the 24 microsurgical handpiece, open micro tubing kit and attach open end of double lumen tubing to the standard selector tubing kit. Connect the other end of the tubing to irrigation and aspiration ports on the back of the microsurgical handpiece. Using the sterile white hose clips, attach the tubing to the handpiece cable. Place the first clip approximately 2 inches back from the handpiece, and the subsequent clips at about 6-inch intervals. Pass the remaining tubing and the handpiece plug off to the circulating nurse. Push the filter on the tubing kit into the aspiration filter connection port on the left side panel of the console. Next, follow the diagram on the left side of the console. Route the large bore aspiration tubing through the pinch valve and connect the end of the tubing to the patient port opening on the suction canister. To route smaller irrigation tubing, first, unclip the latch of the peristaltic irrigation pump. Place the IV tubing over the roller of the pump. The spiked and capped distal end will exit the top of the pump next to the irrigation pole. Close the latch, ensuring the latch is pressed firmly down. Remove the cap from the spike on irrigation tubing and spike the IV bag. Connect the handpiece plug to color-coded port on front of console. Plug foot switch into foot switch socket located on left side panel of console. Place foot switch in a convenient position for surgeon. Depress the irrigate pedal on the foot switch until fluid completely fills the tubing line to the handpiece and irrigant flows from the tip of the handpiece. Depress the power pedal on the foot switch for no more than 5 seconds to activate the handpiece. Check that both warning lights go out. Also, check that a fine aerosol spray appears at the tip, showing that ultrasonic power is present. The selector is now ready for use by the surgeon. The surgeon should check that aspiration, irrigation, and power are set to the desired level. These may be readjusted at any time during the operation by the appropriate increase and decrease buttons. To operate the ultrasonic aspirator, the surgeon depresses the power pedal. Aspiration operates continuously. Irrigation is activated at the preset level when the pedal is depressed, and the ultrasonic power is controlled in a linear fashion, so it increases with the downward pressure on the power pedal. At full depression, the maximum preset level is reached. When the power pedal is depressed, the timer monitors the duration of the ultrasonic power application. The time can be returned to 0 by pushing the reset button. For irrigation only, depress the irrigate pedal. Irrigation will flow from the end of the handpiece at a rate of up to 50 milliliters per minute, depending on how far the linear irrigate pedal is depressed. Should a handpiece fault occur, the red warning lights will flash and an alarm will sound. It is advisable at intervals during the operative use to immerse the tip for a moment in sterile saline. This flushes the handpiece and prevents debris from drying on the inner surfaces, and so minimizes the risk of blockage. Should a block occur in the handpiece, the stylet should be passed up the central aspiration channel until the blockage is cleared. Then place the tip in sterile saline as before. Never pass the stylet down the rear aspiration port. This may damage the handpiece. After the procedure, initially flush the handpiece by aspirating at least 100 milliliters of water. Then remove the hose clips before detaching the tubing from the handpiece cable and the connector from the console. Turn off the power switch, which is located on the rear of the console. Remove the power cord, wipe it clean, and store it in the rear of the service module. Disconnect the foot switch and wipe clean. If necessary, it can be immersed while keeping the plug dry. Soak in warm water and detergent and rinse. Allow to drain before storing in rear of service module. Remove the irrigation tubing from the pump and the pinch valve, and remove the aspiration filter from the console. Remove the liners from the suction canister and discard the tubing set, suction liners, and IV bag according to procedures for disposal of contaminated waste. To clean the handpiece, prepare cleaning solution of warm water containing detergent in a sink or bowl. Remove and discard clear flue. Remove black shroud and place in cleaning solution. Warning: failure to use the appropriate selector wrench set during disassembly and assembly may cause damage to the selector handpiece. Using the appropriate wrench set, place flat one of the handpiece and secure in the appropriate sized slot of the holder. Using the appropriate sized end of the spanner, loosen the tip, turning it counterclockwise. Unscrew the tip by hand and discard if applicable. Otherwise, place tip in cleaning solution. Some tips are single-use, and others have limited use. See tip set package label for details. Reposition the handle of the handpiece and secure flat 2 in the appropriate sized slot of the holder. Using the spanner, loosen the silver angled extension by turning it counterclockwise. Detach the angled extension and place it in the cleaning solution. Keeping the handpiece plug dry, place the handpiece handle and cord into the cleaning solution. Warning: plugging a wet handpiece plug into the console can cause severe damage to the console and the handpiece. Thoroughly clean lumens of disassembled handpiece and parts by inserting the aspiration port brush in the direction of aspiration. Always push the port brush through from the tip end of the handle. Never enter via the rear of the handpiece, as this could result in internal damage. Keeping the handpiece plug dry, rinse all parts in clean water and dry with a clean, soft cloth. Clean the wrench set in the cleaning solution and then rinse with clean water. Place wrench set in the sterilization tray. Place disassembled handpiece, angled extension, shroud, and wrench set in the sterilization tray. If using the reusable tips or non-sterile tips, add a tip and flue to the tray. Follow handpiece sterilization parameters as indicated in the Selector Integra Operator's Manual.